promising a healthy life, producing revolutionary thinking for happiness, providing innovative medical technology for a better future. We at Intromedic are at the premier stage to lead the above issues. EG scan is an esophagoscope designed to visualize the lining of the esophagus as an adjunctive tool in the detection of abnormalities of the esophagus. Visualized images are viewed via EG View software installed on the display system for diagnosis of disease related to the esophagus. EG scan competitive advantages. Disposable. Safe and effective disposable scope. Ease of use. Flexible tube material for ease of transnasal insertion. Quick diagnostic view of the esophagus. Patient comfort. No need for sedation. EG scan disposable esophagoscope procedure overview. Patient preparation. Because EG scan esophagoscope system is inserted through the nasal cavity, pre-treatment of the nasal cavity should be performed. Through the pre-treatment of the nasal cavity, the patient will not feel pain by anesthetic of nasal mucosa and avoid an epistaxis caused by mild mucosal damage. Medical examination by interview. Check for any drug allergies. Check for history of operation or disease of the nasal cavity. Check for frequent history of nosebleeds. Check whether the patient is taking an anticoagulant or antiplatelet. Check to see if the patient has small nostrils or stuffy nose. Take anti-foaming agent. Take simethicone diluted with water. Note: because the anti-foaming agent removes the bubbles in the digestive canal, as well as protect the lens from foreign substance, the patient should take anti-foaming agent prior to the procedure. Take vasoconstrictor. Take 1 cc epinephrine diluted with 4 cc lidocaine. Take surface anesthesia. Spray 5 cc lidocaine solution to each nasal cavity. Nasal anesthesia. Spray 10% lidocaine and apply 2% lidocaine jelly at the 7 Nellatone catheter. Insert the probe through the nasal cavity about 10 centimeters. Keep the probe about 10 minutes. Caution: when inserting the probe, if pushed with force, bleeding or pain may occur. Note: the nostril for insertion is selected by the following test. Press one nasal cavity with a finger and breathe out a few times. Repeat a few more times and select a well-ventilated nasal. Indication for use. The EG scan esophagoscope system is intended for use in endoscopic access and examination of the larynx, esophagus. Contraindication: not intended to apply to patients who has had a history of broken nose or disease of nasal cavity. Not intended to apply to patients who have severe history of disease. Not intended to apply to patients who are in a state after gastric surgery. Not intended to apply to patients who have COPD, CHF, CRF, and any disease with respiratory disturbances. Preparation procedure: remove the debris of the nasal cavity by using a cotton swab. Insert probe into the nasal cavity in the direction perpendicular to the face or downward to the face. Insert probe to pass through nasal vestibule, middle turbinate, and inferior turbinate. Insert the probe through lower side of the middle turbinate or to pass through the lower side of inferior turbinate and nasal septum. EG scan controller is capable of bending up and down using bending trigger. When the probe passes through the esophagus, let the patient swallow the saliva. Be careful not to stray out the end of probe from the esophagus and insert probe inside the esophagus. If you press the freeze button, then the screen will pause. At this moment, the user can save the frozen image by pressing the capture button. EG scan is capable of checking the esophagus through the nasal cavity. Press the red button of the screen to record video. After the procedure, turn the controller's locking mechanism to remove the probe and dispose of the probe. Probe is disposable, so throw the used probe away in the medical bin. To save captured image as image files, go to Report mode and press Export button. To save video as an AVI file, go to Menu, select the file from the list, and click Save as Video button.